Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's session is part of our Paving the Path to Wellness series, a special collaboration between the Blum Center and Mass General Brigham Cancer Institute. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has music and hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to complete. Your feedback is important to us as we plan future programs. So joining us today, we have Kirsten Anderson. Kirsten is a senior clinical social worker at the Mass General Brigham Cancer Institute at Newton Wellesley Hospital. She specializes in the intersection of mental health and cancer care, supporting individuals coping with the emotional and psychological impact of diagnosis, treatment, and survivorship. Kirsten co-facilitates Paving the Path to Wellness, a lifestyle medicine-based survivorship program, and leads an expressive writing group for cancer survivors. Joining us today, we also have Dr. Stephanie Eisenstadt. Stephanie is internist, academic physician leader, medical educator, and certified coach at Massachusetts General Hospital. She is also assistant professor of medicine at Harvard Medical School and faculty at University of Chicago Graham School. Over the years, her work at Mass General has centered on improving the care for women, chronic disease management, and cross-disciplinary care redesign. Her current clinical practice is based in the Mass General Brigham Cancer Institute Lifestyle Medicine Program, helping cancer survivors adopt evidence-based preventive care and lifestyle medicine practices to enhance recovery, decrease cancer recurrence, and improve prognosis. In addition, she serves as a group leader for the Paving the Path to Wellness program for breast cancer survivors. In her educator role, she has participated in a number of patient-focused initiatives and care redesign efforts, and has authored a number of books and articles for both professional and lay audience, including The Primary Care of Women, The Harvard Guide to Women's Health, Every Woman's Guide to Diabetes, clinical handbooks on chronic disease management, and is the author of one of the first manuals to help clinicians design and conduct group medical visits entitled Putting Group Visits into Practice. They both join us today to give a talk on Mindset Matters, the role of attitude and resilience in cancer survivorship. So please join me in welcoming Kirsten and Stephanie.
Thank you so much. I'm just going to share the slides. All right. Can you confirm that you can see those? Wonderful. Okay, great. Hi, everyone. Thanks so much for joining us for Mindset Matters, the role of attitude and resilience in cancer survivorship. Today, we will explore how the way we think and respond to challenges can influence both our emotional well-being and our physical recovery after cancer. To give you a sense of where we're headed today, we will start by looking at how stress affects the body and mind in the context of survivorship. Then we will talk about the role of mindset, specifically thinking about how our attitudes and beliefs can shape healing and resilience. And then finally, we will highlight some evidence-based practices that can help manage stress and support overall well-being. And before diving into all of this, let's zoom out and place today's topic within the lifestyle medicine framework that guides this entire paving series. So when we talk about cultivating resilience and well-being, we are really talking about lifestyle medicine, which is an evidence-based approach that uses everyday behaviors to prevent disease, promote healing, and enhance quality of life. In cancer survivorship, lifestyle medicine provides a foundation for recovery, strengthening both the body and mind. So what exactly do we mean when we say lifestyle medicine? Lifestyle medicine is a field of clinical practice that uses evidence-based lifestyle interventions to support health, promote healing, and reduce the impact of chronic conditions. It focuses on these 6 key areas: nutrition, avoidance of risky substances, physical activity, sleep, stress management, and social connection. These are the 6 core pillars of lifestyle medicine, and they collectively work together to support well-being. Each one strengthens the others. So even small improvements in one of these areas can create positive ripple effects across all aspects of health and wellness. And it's these 6 pillars that inspired our Paving the Path to Wellness program here at the Mass General Brigham Cancer Institute. Paving is a wellness course offered to oncology patients here at Mass General, primarily breast cancer survivors, though we are looking to expand it to other cancer types. And so what you see on the screen here is what we call our paving wheel. It lays out the 12 core topics we focus on, blending lifestyle education with evidence-based approaches to support one's overall well-being. And our goal throughout paving is to help participants set realistic, meaningful goals for life after treatment. And while the larger paving program touches on all 6 pillars of lifestyle medicine, today we will really be focusing in on one of them: how stress management and mindset support healing and resilience across body, mind, and spirit after cancer. With this in mind, let's talk about stress. Stress is a normal part of life, and after cancer, it can take on new layers. Physical recovery, emotional adjustment, and uncertainty about the future can all activate the body's stress response. So in this next section, we are going to look at how the biology of stress interacts with our thoughts and emotions, and how this connection can either hold us back or help us grow after a cancer diagnosis. Understanding these reactions helps us regain control and choose how we respond, rather than letting stress take the lead. So with that, I'll hand it over to Stephanie.
Well, thank you, Kirsten, and welcome everybody. So, Hans Selve is considered the father of stress research. He studied stress and cancer in animals following his own diagnosis of a rare cancer. And he noted that stress could be both good and motivating or bad and lead to distress. And he described 3 phases of a stress response. The first is alarm, when something stressful is happening. The second is the tension one feels when under stress. And the third is what he calls resistance, or all the work that your mind and body does, making your way back to a steady state. And this phase in particular is often associated with exhaustion. Dr. Rodney Luster described the stress arc that's shown here. And stress occurs when the perceived pressure on you exceeds your ability to maintain your resilience or your capacity to manage all of those demands. So consider the following questions for yourself. What are the ways that you calm yourself down when you feel you're experiencing stress? Do you have 2 to 3 relaxation techniques that you use in times of crisis? Are you able to step away from a situation before reacting? Do you spend more time peaceful than angry? And do you have a happy place or a time in your life that you can recall when currently things are quite tough? Kirsten, the next slide. So Dr. Walter Cannon, a physiologist in 1915, described what naturally happens in your body when you experience stress. He found that there's a general discharge of your sympathetic nervous system, which is part of your autonomic nervous system, which responds automatically to perceived acute danger. This is better known as your fight or flight response. It's our problem-solving center in response to stress. So with this, there's a release of neurotransmitters that make up that acute stress response. Starting in the hypothalamus, which is deep in the center of the brain, stress increases dopamine, which can in turn increase anxiety. Norepinephrine is released deep in the brainstem, but also from the adrenal glands located above your kidneys and through the hypothalamic pituitary adrenal axis. In response to stress, the adrenal gland releases cortisol, which is a hormone that can increase inflammation response in your body, increasing your heart rate, blood pressure, blood sugar. Epinephrine, or known as adrenaline, is responsible for that adrenaline rush that you feel when you're scared. GABA, or gamma aminobutyric acid inhibitory neurotransmitter, is in the brain and inhibits GABA that helps to regulate blood pressure, sleep, and attention. And the serotonin, the small amount released by the brain, is affected by stress with low levels of release exacerbating depression. Other substances that are released include insulin, insulin-like growth factor, other hormones and peptides, all impact mood, sleep-wake cycles, appetite, and pain. And he observed that release of all of these transmitters at once led to a state of a hyperarousal. To survive as a species, our brain first recognizes we're in danger. That's in the prefrontal cortex and the amygdala, and then sends the message that the lion's going to eat us. We respond appropriately, in this case, protect ourselves against the danger. As I mentioned, this is an automated response, this flight or fight response. Our bodies really feel it. Our heart beats faster, our blood pressure goes up, muscles can get tense, the immune system is suppressed, your gut microbiome can be disrupted, we breathe faster and take more shallow breaths, we sweat, we pump out that adrenaline, norepinephrine, cortisol, less insulin, and our blood sugar goes up. This is all so that we can run away from the lion. But we can't be running away from lions in our life continuously every day. Kirsten, the next slide, please. And this is because doing this leads to chronic stress. And over time, chronic stress builds up and takes its toll. So researcher Steve Cole in 2012 found that chronic negative emotions associated with chronic stress not only impair the body, but impair brain function. So chronic stress can interfere with learning, with our executive brain function, and decision-making centers. And high levels of these stress substances, like the cortisol and epinephrine, can increase the risk for many chronic disease conditions and result in a variety of physical symptoms, including headaches, joint pain, fatigue, disruption of sleep, mood changes, and digestive changes. Next slide, please. So there's been a lot of research done to define stress as it relates to peak performance. Can stress serve a positive purpose? Well, regarding performance, researchers have found that what they call this healthy tension, or eustress, can be motivating versus the opposite, or unhealthy imbalance, or the distress, which is a state of overload and can result in fatigue, exhaustion, panic, anxiety, anger, and burnout. The eustress state, where one's focused and motivated, can actually be quite positive and motivating for peak performance. Also remember that tension can be, in certain circumstances, so low that we actually get bored and become inactive. So Dr. Kelly McGonigal, in her book, The Upside of Stress, encourages people to engage with the healthy tension and try to avoid the unhealthy imbalance. Researchers Dan Siegel and his colleagues have looked at the best state of mental arousal following a traumatic event, and they identified 3 arousal states. First, a calm arousal, then a hyperarousal, and hypoarousal. All can affect our behavior. From their research, they found that every day we naturally go in and out of these 3 states as we experience stress. The calm state is the one that we strive for. We're calm, alert, connected, we self-soothe, deal with the challenges, regulate our emotions, and feel we have some psychological flexibility. But we can easily get overstimulated with stress and get pushed into and out of that window into hyperarousal. And this is when you experience that excessive activation and energy. It can feel like anxiety, panic, fear, hypervigilance to your environment around you, and emotional flooding and catastrophizing. And we get stuck there. It's difficult to sleep, to eat, to digest, and optimally to manage our emotions. And in the extreme, you can actually feel rage and anger and some hostility. So then there's the hypoarousal, which is the opposite end and can follow, and that's where we shut down. We feel that exhaustion, depression, maybe a flat affect, numbness, a sense of disconnectedness. We can find that we want to sleep all the time and have no appetite, even have chronic fatigue. So what is their point? Their point is that we need to listen to our body changes as they are happening in real time. And stress reduction practices can often help ourselves get back to calm. So finally, in a special series, the National Cancer Institute highlights the chronic stresses related to breast cancer, which can really be generalized to anyone experiencing cancer. In addition to the treatment plans and the protocols, the surgery, radiation, all the body changes, there's a lot of uncertainty having cancer about both the present and the future. Will the cancer come back? Will I have enough energy to go back to work and be present for my family? Who am I now? Am I defined now by my cancer? How do I deal with these body changes? How will this affect my relationships? And will I be able to keep up with all the things I need to do to stay healthy? So back to you, Kirsten.
Great, thank you. Yeah, and so here, when we think about stress after cancer, we often first think about what's visible: the scans, the appointments, side effects, going back to work, physical recovery. But beneath the surface, much like Stephanie was describing, stress affects our mind, emotions, and sense of meaning in deeper ways that aren't always seen or talked about. So you'll see here on the iceberg, hiding underneath are the emotional and cognitive layers of cancer survivorship: fear of recurrence, identity shifts, fatigue, grief for the old normal. Like an iceberg, most of the weight lies below the surface. So recognizing all these layers allows us to care for the whole person, not just what's visible up top. And one of the most common stressors that sits below the surface for many survivors is fear of cancer recurrence. Almost everyone feels it at some point, and it's important to know that this fear is completely normal. It's actually our mind's way of trying to protect us. The reality is, we can't always make the fear disappear, and that is okay. What is most important is actually learning to acknowledge it and care for ourselves when fear shows up. Reaching out to your care team or connecting with other survivors can remind you that you're not alone in this. When worry feels heavy, it can be really helpful to shift your focus to the things you can control. Things like movement, rest, nourishment, listening to a favorite song, watching a funny video, taking deep breaths. These acts of self-care can help lower stress and soothe your body and mind. And once we name this fear, we become better able to notice when it shows up and even start to plan for its arrival. It's really common for this fear to show up before a scan, with a new ache or physical sensation, around a cancer anniversary date, or after hearing about someone else's diagnosis. When that happens, we like to remind survivors, name it to tame it. In other words, acknowledging what you're feeling is the first step toward easing its grip. From there, it's about finding what helps you move through the emotion, calming the body through relaxation practices like mindful walking, breathing, or imagery, and retraining the mind with compassionate self-talk, such as, I can't control every outcome, but I can control how I care for myself today. Resilience grows through these small, steady habits like gratitude journaling, humor, movement, good sleep, and setting healthy limits around information overload. While these practices don't erase fear, they do help you stay grounded and meet difficult emotions with a sense of calm, compassion, and strength. And when we practice these coping skills, we're doing more than just managing fear. We are reshaping how we respond to stress. In the same way, our mindset plays a powerful role in healing and building resilience. In this next section, we will explore what it means to cultivate a mindset that supports growth and recovery. And I first share this quote: "If you choose not to find joy in the snow, you will have less joy in your life, but still the same amount of snow." And I really love this quote because it captures the essence of mindset so well, and it's especially relatable for us in New England. We can't always change the circumstances or the weather that we find ourselves in, but we can choose how we approach them. Finding moments of joy in difficult situations doesn't erase difficulty. Instead, it does help us move through it with a little more hope and perspective. So passing that back to Stephanie.
Thank you, Kirsten. So let's turn for a moment to talk about how our brains can help or hinder us as we try to manage and recover following stress. And there's three areas we'd like to cover now. First is noticing and managing our own automatic negative thoughts, or ANTs. These are unhelpful thought patterns that shape our behavior and our own self-talk, and then they can really get in the way. Every day we have about 70,000 thoughts that go through our brain, and a lot of them are negative. Dr. Aaron Beck, who is the founder of cognitive psychology, found in his research that negative ideas about ourselves, our world, our future permeate our thoughts. For example, thinking, I'm a loser. I never do anything right. Nothing is ever going to go right for me. I should have done that. The various ways that we beat ourselves up, all these negative thoughts, can spiral and become habits, creating a vicious negative cycle. So we're going to talk about how to manage that inner critic and begin to rid ourselves of these kinds of thoughts. The second concept we're going to talk about is the growth mindset, and how being in a growth mindset can help to discover possibilities and opportunities for growth versus always being in a fixed mindset. Can we learn from our efforts and our experiences rather than always focusing on whether we've achieved that perfect outcome? Can we reframe mistakes as learning opportunities rather than personal failures? And can we harness the power of yet? The third area we're going to cover is understanding the impact of being in a learning versus protective mode. Shaming can further activate the stress response, which in turn activates the protective mode. Curiosity, caring, and kindness towards oneself activates a learning mode and can help to support lasting change. So next slide, please. So let's start with these automated negative thoughts. Dr. Daniel Amen has popularized the concept of automatic negative thoughts in his book, Change Your Brain, Change Your Body. Basically, what happens is your brain is fooling yourself into thinking that your negative thoughts are accurate, logical, and the only truth, when in reality, they serve only to reinforce negative thinking and emotions and keep you stuck. There's over 200 ants, also known as cognitive distortions, and these ants deplete beneficial brain chemicals that we just reviewed, for instance, the serotonin and dopamine. And through his research, Dr. Amen believes one can overcome the negative impact of these ants through a process of reframing and positive self-talk. So Dr. Amen refers to the 9 most destructive ants as red ants, and he frequently reminds us, don't believe everything you think. Here are some examples, and you might recognize some of them. Black and white thinking, thinking in absolutes, always, never, everything. Any mistake means you are a failure. Focusing on the negative and dismissing the good in favor of the bad. Fortune telling, thinking only of the worst case scenarios. For instance, I'm sure I'm going to fail. Mind reading. You think you know what the other person is thinking and make assumptions based on that. Thinking with your feelings. You don't even question the negative feelings. It's just seen as the truth. being ruled by shoulds. I should have, I would have, I could have. He calls this guilt beating. Labeling. I made a mistake. I am incompetent. These labels that we attach to ourselves can then become self-fulfilling prophecies. Taking things personally. It turns out that people don't think of us as much as we think they do. And then blaming others or externalizing. I feel bad because you made me feel bad. Next slide. Sajaya John, author, poet, and spoken word artist, puts it really well. Be very careful how you talk to yourself. It becomes your life. Words are seeds. When you say them and you think them, you plant, water, and sun them. They then obey. So how do we start talking to ourselves differently, moving away from all the negative self-talk and engaging more in the positive? Well, the first step is to challenge your brain and your thoughts and ask yourself, is this thought true? Does having this thought serve me in some way? Is there another perspective or way to think about these thoughts that are coming in? And what advice would I give a friend who's having these same thoughts? Along with this, engaging at what Martin Seligman calls the PERMA model, or the 5 building blocks of well-being, can actually be quite helpful. P stands for positive emotions. That's achieved through practicing gratitude, looking at what is positive, how you can balance out the positive to be able to take care of the negative, savoring the specialness of experiences, a mindfulness and slowing down the brain, and having hope and optimism. E is engagement, which is experienced by getting in what he and his colleagues call a state of flow. For instance, addressing a challenging task through your skills and your strengths. R is relationships, creating and maintaining high social connections that are meaningful to you. And M is meaning and purpose, belonging to something bigger or beyond yourself. And then A is achievement, having accomplishments and successes that are aligned with your aspirations and your values. Next slide, please. Which brings us to the growth mindset. So a mindset is a set of beliefs and values that influence our emotions and drive our behaviors and actions. And Carol Dweck at Stanford is a key researcher of the growth mindset. Growth mindset is going from an attitude of nothing is going to change, and that's called the fixed mindset, to one of possibilities, or the growth mindset. And when in a growth mindset, mistakes and things that go wrong actually become opportunities for learning, and curiosity is an essential element of that growth mindset. When faced with crises, we generally have these two competing brain responses that can impact being able to even embrace a growth mindset. So one is the learning mode, where we feel confident and calm and collaborative, and we view events with curiosity and from a problem-solving perspective, which tends to lead to the growth mindset, versus a protective mode, where we're feeling scared and threatened, got to run, got to get out of here. Sometimes we even feel combative, which can keep us in a fixed mindset. Next slide, please. So let's drill down on this for you. So ask yourself, am I in a fixed or a growth mindset? Well, how would I know? Well, here's a quick assessment that might help you. We suggest you rate yourself on how accurate the following questions are for you, where 1 is not accurate at all, 3 is somewhat accurate, and 5 is highly accurate. And a higher score indicates a trend towards a growth mindset, whereas a lower score is more of a fixed mindset. And here are the questions to think about. I often experiment with new ways of doing things. Another question, I treat failure as an opportunity to learn and grow. I believe I can succeed if I just have the right attitude and invest enough effort. I seek out challenges that will help me to grow and learn. I seek out others' feedback, even if it's negative. I regularly take time to reflect on things, how things are going, and the implications for the path forward. I am comfortable with ambiguity and uncertainty. I like to get input from others with diverse perspectives when I have an important decision to make. I don't take it personally if I get negative feedback or if I don't succeed at something. So this will help you to think about growth mindset in a deeper way. And with that, back over to Kirsten.
Great, thank you. Yes, so the power of yet reminds us, like Stephanie was saying, that language really matters. When we say, I can't, it feels like a full stop. It tells the brain, this is it, dead end. And that kind of self-talk keeps us stuck in a fixed mindset. But when we add yet, we open the door to possibility. We start to say, I can't do this yet, or I haven't figured it out yet. That one word shifts our mindset from perfection to progress. Research shows that this small change in language can increase motivation, resilience, and self-compassion. And later in the presentation, we'll circle back to this idea and look at some examples of how you can practice using the power of yet in your own life. And so if yet is reminding us to have patience with growth, self-compassion reminds us to be kind along the way. Many people think and worry that kindness towards ourselves means lowering standards or becoming complacent, but research shows that actually the opposite is true. Self-compassion increases motivation and helps us recover from stress more effectively. It's about treating ourselves with the same grace that we would offer a friend, shifting our inner voice from one of criticism to one of support. And a healthy mindset doesn't mean we only feel positive emotions. All emotions, even the difficult ones, are part of being human. What matters is how we respond once they show up. That's where our coping styles come in. We all tend to lean toward one or more common coping styles. Task-oriented coping is when we deal with stress by taking action, making a plan, gathering information, or problem solving to regain a sense of control. Emotion-oriented coping means we focus in on our feelings, talking with someone we trust, crying, journaling, or seeking comfort and support. Distraction-oriented coping is when we give ourselves a break, watching a show, going for a walk, listening to music, or doing something that helps us reset. Most of us use a mix of these styles. The key is noticing what works and when it might help to shift approaches. And even when we're using our best coping strategies, there can still be moments that feel overwhelming. And in those instances, reaching out for social work, a counselor, a loved one is not a sign of weakness, it's a form of resilience. And so we've talked about how mindset influences the way we experience and cope with difficult emotions and stress. Next, we want to talk about some evidence-based practices that can help calm the body, focus the mind, and strengthen stress resiliency. One of those is mindfulness, which is one of the most effective evidence-based strategies for managing stress. It means bringing awareness to the present moment without judgment. The situation is how it is. Mindfulness helps quiet the body's stress response and re-engage the parts of the brain that regulate focus and emotion. Research shows that mindfulness practices can improve mood, concentration, and even immune function. So let's take a moment to highlight a few of these proven techniques. The first here is what we call box breathing, where you inhale through the nose for a count of 4. You would count 1, 2, 3, 4. Hold that for 4. Exhale through the mouth for the count of 4, and then hold for 4. And we recommend doing that, about 4 or 5 times. And really great times to practice this type of breathing is during a tense moment to help slow the heartbeat and reset focus. Next, we have 4-7-8 breathing, which we inhale through the nose for 4, but then we hold for 7 and exhale slowly through the mouth for the count of 8. And this elongated exhale is what activates the parasympathetic nervous system, that part in our brain that activates the relaxation response. And so this is a great strategy to try before bed or after appointments to promote calm and relaxation. We also have 5, 4, 3, 2, 1 grounding, where you notice 5 things you can see, 4 things you can touch, 3 that you can hear, 2 you can smell, and 1 that you can taste. Or it might be the absence of taste if you do not have anything flavorful close by. And this is a great strategy to use when your mind is really racing, right? A lot of those what if thoughts, thinking about the past, thinking about the future. This technique anchors your attention back in the present. And what's really great about the 5, 4, 3, 2, 1 grounding strategy is you can do it anywhere. You always have your 5 senses. One of my favorite ways is during a mindful walk, where you can tune into your 5 senses as you move, noticing the colors around you, the sound of your footsteps, the feel of the air, the scent of the season. You can even get curious about the sensation of lifting each foot and feeling it land on the ground. When was the last time you really focused on what it felt like to walk? And then we have progressive muscle relaxation, guided imagery, and body scans, which are all powerful tools for releasing stress held in the body. There are many free guided recordings online that can walk you through these exercises step by step. And so at their core, all these practices help us train our attention and bring the nervous system back to a state of calm. This next set of strategies, they bring together many of the tools we've already been discussing. I'll highlight a few favorites that survivors often find most practical and effective in daily life. At the top, we have our behavioral tools, which include the breathing and mindfulness practices I just mentioned. We also like to highlight a technique called temptation bundling, where you can pair a stressful or tedious act with something enjoyable or relaxing. For example, listening to uplifting music during chores, or going out for coffee with a friend after a medical appointment. Cognitive tools work with our thoughts, reframing our thoughts, shifting perspective, talking to ourselves more kindly, scheduling time for worry. We also want to think about practical habits that help build stress resiliency, starting to identify triggers, making a plan. Who can you call if you're having a bad day or need a distraction? Making sure to prioritize good sleep, and thinking about ways to release stress and tension, such as through movement, creativity, and connection. And then finally, understanding our coping style helps us choose what's most effective in any given moment. Problem-focused coping is useful when we can take action to change something. Emotion-focused coping is an important approach when we can't control the stressor, and instead, we shift our attention to what we can control, such as how we manage our emotions and take care of ourselves. Back to Stephanie.
Thank you, Kirsten. So Robert Emmons has studied the positive impact of cultivating what's called a gratitude practice. And this can come in many forms. It can be about writing a thank you note to those in your inner circle. It can be sending a supportive email to yourself to keep you on track. At the end of the day, listing or saying out loud 3 things you're grateful for or what actually went right that day. And the impact of gratitude has been studied and has been shown to increase well-being, result in improved relations, and enhanced resiliency, especially in those with a history of trauma. And gratitude has been associated with better sleep, better physical health, less depression. There's been over 70 studies looking at gratitude involving more than 26,000 people. The American Heart Association has been so impressed by the data on the impact of gratitude in preventing heart disease that they now include gratitude practice as a recommended strategy along with lowering cholesterol and exercising and stopping smoking in preventing coronary artery disease. So what does the data suggest as an effective practice? Well, in a randomized trial, researchers found that focusing on gratitude for less than 15 minutes a day, 5 days a week for at least 6 weeks can enhance mental wellness and promote a lasting change in perspective. So the point is to talk to yourself in a more creative, optimistic, and appreciative manner and catch yourself when that inner critic is coming to surface. Next slide, please. So, as we mentioned earlier, we all have that inner critic inside. For some, it may be louder than for others. Dr. Amen suggests that we talk to that inner critic as a person. First, write down those ants so that you can see the patterns of your thinking. Then turn the ants into what he calls pets, or positive, empowering thoughts. Go through a short reframing process. So, what are some examples of cognitive reframing and overcoming that inner critic? Well, so a negative self-talk would be, I won't be good at this. To, this is an opportunity to learn something new. Even if I'm not good at it in the start, it takes practice. Negative self-talk would be, it's just too complicated. I don't understand and I want to quit. To, well, I can try to look at this differently and ask for help. Negative self-talk, I don't have any time. To, well, I'm going to look at my schedule and see where I can fit this in. I might need to re-examine my priorities. Kirsten?
Great, thanks. And in a similar fashion, we'll circle back to the power of yet, a simple but powerful tool for shifting from a fixed to a growth mindset. And so here are some practical examples of how this can show up in everyday life after a cancer diagnosis, along with examples for how you might start to apply yet in your own healing journey. A couple examples here: I can't get through the day without a nap anymore, turns into, I haven't figured out how to balance my energy yet, but I'm learning what helps me recharge. Or, I'm too anxious to enjoy my life, turns into, I haven't learned how to calm my anxiety yet, but I'm working on strategies that help. And as you think about some of these examples, you might ask yourself, where do I tend to say I can't? And how might adding yet shift the way I approach it? What small step forward becomes possible? And remember, growth doesn't happen all at once. Just like a garden, our well-being needs tending. What helps one day may not be what we need the next. Tending the mind-body garden means noticing these changes and caring for ourselves accordingly. We plant new habits, we pull what drains us, and nourish ourselves with rest, compassion, and laughter. Reflection and gratitude enrich our soils, and connection reminds us that some things grow better together. A healthy garden thrives on variety, a mix of seeds, tools, and care for different seasons. That variety is what makes it adaptable and resilient, allowing us to keep growing even as circumstances change. And I love this reminder: be patient with yourself. Nothing in nature blooms all year. It's a beautiful way to remember that growth comes in cycles, and that giving ourselves time to rest is what lets new growth and color return. So if you've attended other paving talks or participated in the paving program, you've probably heard us talk about SMART goals, and that's not going to change today. Goal setting is one of the tools that helps us turn intention into action. It's how we move from thinking about change to actually doing it. Once you've identified a goal, for example, I want to relax more, try shaping that intention into a SMART goal, something specific, measurable, attainable, relevant, and time-bound. So to turn I want to relax more into a SMART goal, that might look like, I will take a 15-minute walk 5 times a week for the next month to reduce stress. And as you think about creating your own SMART goals, here are a few places to start reflecting. What strategies are you already using to support your mindset and well-being? And which might you want to strengthen, reintroduce, or try for the first time? When you think about your coping patterns, is there one you'd like to rely on a bit less, or one you'd like to lean into more often? What's one way you could respond differently the next time negative thoughts show up? Whether that's naming them sooner, challenging them, or shifting your focus. And how could you create more regular space for stress reduction in your life through mindfulness, movement, rest, or time in nature? Even small steps practiced with care and consistency can nurture resilience and growth. And remember, you don't have to do it all alone. If you'd like to explore these topics further or need help getting started, We have many great resources within the Mass General Brigham Cancer Institute, as well as in the community, that can support you either one-on-one or in a small group setting. Thank you.
Thank you so much, Kirsten and Stephanie. We are now at the end of the session. If you have any questions or even thoughts you'd like to share, feel free to enter them in the chat. We have a question from our participant. Can you talk a little bit more on burnout and when it might be a sign of moving through stress? She believes in your first slide, you talked about stress and how fatigue is part of regaining your balance versus a sign of being an active stress overload.
Mhm. So I'll start and then I'll turn it over to Kirsten for her thoughts. Burnout is a popularized term that's used usually in response to your external environment, where you find yourself emotionally and physically exhausted. You feel negative and a lot of cynicism around your circumstances and overwhelmed and disconnected. And these kind of feelings that you have often are a message to you. It's your mind and body telling you that you should reach out, that you don't need to feel that kind of pain and suffering, and that there's people around you that can help. So reaching out to your care team, I think, is really important when you start to recognize those symptoms. Kirsten, do you have anything to add to that?
Yeah, I think this is such a great question, right? And I think really I can tell this person's really trying to tune into the difference in stress levels and kind of knowing, what's normal and healthy, and maybe when is it a sign of something needing to change, right? And so I think when we think of burnout, we're thinking of the fatigue of moving through stress and your body catching up with you after being in high gear. Usually with some rest and recovery, you start to feel a bit better. But if you're in stress overload, rest might not really help. You might still feel drained, detached, numb, or hopeless, even when you're resting. And that's your system's way of saying that the load over time has become too heavy. And in that case, it's less about pushing through and more about figuring out how to lighten the load, setting boundaries, asking for help, and focusing on things that regulate your body and mind, and like breathing, sleep, movement, connection, all the things we just talked about. That's a really great question.
Thank you. Our next question is, can you share a little bit more about scheduling a time for worry, what that means and how you can do that?
Yeah, I was hoping someone would ask about this. So worry time is really a tool to put you back in control of worry instead of the other way around.
Mhm.
You set aside a short window of time just for worrying each day, either like between 10 to 15 minutes. And when worry shows up at other times during the day, you remind yourself, I'll think about that later. You might even write the worry down and, tell worry, I'm saving this for later. I'll get back to you at 2 o'clock at our scheduled worry time. And it teaches your mind that worry has limits and that you get to decide when to engage with it. And this is also, I think, a good balance between, we're not saying avoid your worries and pretend that they don't exist, right? Because that's not helpful either. But it's, again, engaging with worry on your terms. I don't know, Stephanie, if there was anything you wanted to add or if I covered it.
I just think that the idea of worry postponement, that you don't have to suffer with it. There are strategies where you can have more agency and feel that you can process the worry and think about how that might help you to problem solve going forward.
Mhm. Yeah, well said. Yeah, right. I think over time, if we keep responding to worry and stress with such urgency, we can actually unintentionally train our brain to respond that way in an ongoing way. And so some of the strategies we're talking about allow you to perhaps have a less overactive smoke alarm in your head, and give you
Like
some more
that.
time. Yeah.
Like that.
I like
Mhm.
that smoke alarm.
Yeah.
You do have a comment from a participant. Great material and ideas to incorporate. It's a great message to be patient with yourself
Mhm.
as you include new practices in your routine. For example, mindfulness is a process and the benefits come in stages.
Mhm.
Absolutely.
Mhm.
And I think it's also important to remember that self-care is not being selfish. It's refueling the tank so that you can achieve all the aspirations, what you want to do, how to be effective in the world, have agency, and so forth. The idea of self-compassion, Kristen had mentioned that this is a way of empowering yourself and using your own assets to your advantage. Kristen, did you want to add anything about self-compassion or the idea of how to embrace self-care?
Yeah, right, right. I think rest, right? This is something we talk about in our paving program, which is rest is a task in itself,
Mm,
right? You don't just, as much as we would like, we don't automatically recharge in a second, right? It takes work to rest and recharge. And so when we start to think of it as rest as an action in itself, a task in itself, then I think that shifts our relationship to what that means. And it no longer feels like I'm just being lazy or unproductive, right? That this is actually the work, taking care of myself.
mhm.
And I think that's a nice segue to the next comment. This person expresses when they're feeling lousy, there isn't much energy to put these practices into action. Do you have any thoughts you'd like to share on this?
Mhm.
Mm. Yeah.
You need to be kind to yourself and listen to your body when your body is telling you you need to refuel.
Mhm.
Kristen?
Yeah, when you're feeling lousy or drained, it can feel almost impossible to use the very tools that are supposed to help. I think that's what you're saying. In those moments, it's not about doing more, it's about doing smaller.
Mhm.
Right. So even one slow breath or getting out of bed to open a window or stand on the front step or texting a friend counts.
Mm,
Again, the goal isn't perfection. It's reminding your body and mind that you do have some control, even in tiny ways. And so trying to build in almost micro pauses in your life and small actions that can be done gently can start that recovery and healing process.
mhm, mhm. I like that micro processes,
Mhm,
right? Um, yeah.
yeah, I can appreciate the pressure it feels to make this like a big thing, right? Where you're going to completely, change your life and start doing, meditations every day, right? And while that is really great and would be really great, sometimes that's not realistic. And that's where we go back to our SMART goals, where it does need to be realistic for where you and your body are at this time, right now.
Thank you. We have a participant who commented how they're very grateful for these sessions, but wish they had learned about these principles before their cancer diagnosis. Are you familiar with any resources, initiatives going on where we can provide this type of education before someone has a cancer diagnosis? Because I know through the Blum Center, we do have a lot of self-care well-being
Mhm.
programs. I mean, they may not cover the same pillars and principles as the paving, but in some shape or form they do. So I don't know if you are also familiar with any additional resources, Stephanie and Kirsten?
Mhm. Well, this is a ever-evolving field. And a lot of the work that's come out of the American College of Lifestyle Medicine has been to promote new practices and strategies in order to improve preventive care education out there, to make it more accessible, and allow for people to connect sooner rather than later to the ways that they can prevent or either prevent disease or slow down the progress of what's happening with them with their medical conditions. Kirsten?
Yeah, no, I think that's well said, right? That yes, lifestyle medicine is growing as more providers, within oncology and outside of oncology, right, become more familiar with the interventions recommended. Um, so while I don't have a specific recommendation, I do think that we all have some of the power now to continue spreading what we are learning here. And while I wish we
Mm,
all could have known it sooner, right, before a cancer diagnosis to this person's point, right, how do we start to influence those around us while the while the rest of the world and science catches up with where we're at.
Mhm.
We have an individual who's commenting how they really like the wellness wheel and how something like that would be nice to have in other offices beyond the lifestyle medicine department.
Yeah, that is an excellent idea.
Mhm. Yeah. I think in schools too, right?
Oh, absolutely.
Yeah. We also love the paving wheel.
Is that by any chance available on your website?
It is.
Good to know. All right, so while we wait to see if there are any final questions or thoughts from the audience, I would like to share, save the date. Our next paving webinar will be on New Paths, New Strength, Embracing Variety Investigations in Cancer Survivorship. And that will be held on Wednesday, December 10th, also at noon. You can visit that Blum Center website. That will take you to the schedule of upcoming events, where they'll provide you more information on this session as well as the Zoom link to attend. All right, so before we end today's session, Kirsten, Stephanie, do you have any final thoughts you'd like to share with the audience?
Just thank you for being here and listening and trying to work through a lot of really complex steps as you go through and hopefully can decrease the amount of stress that you're experiencing. Chris?
Yeah, I think just one small change, one small action has that ripple effect across all aspects of health. And so there's nothing too small when we think about growth and wellness. So
Absolutely. Well, thank you so much, Kirsten, Stephanie, for your time. This was extremely helpful. And for everyone who is attending today, thank you so much. As I had mentioned, today's session is being recorded. It'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Take care.